I think vaccines get quite a hard rap. One of the big misconceptions is that vaccines are only for children, and they're absolutely not. What's the problem to be solved? What's the right technology to solve the problem? Do you know your vaccine status?
Welcome to The Conversation. In today's episode of Trailblazers, Johnny is speaking to Emma Holcroft, CEO and founder of Imunis, a digital health platform that empowers patients to access their own health records. We hope you enjoy the episode and be sure to subscribe.
Emma, it's an absolute pleasure to have you here today.
Thank you for having me, Johnny.
Tell us a little bit about your journey with Imunis and give us a little bit of background on what you're up to.
Okay, so I'll introduce Imunis first. Imunis is an interoperable digital vaccine record and also a adherence kind of tracking companion, if you like. So alongside allowing a family to keep all of their vaccine records together in one place so that you can access them very easily through your phone digitally, it also is programmed with all of the recommendations for when you should take which vaccine, and is able to rapidly deploy changes. So as schedules and recommendations change, we can update the app, and importantly it contains a status in it, so it tells you whether you or your child are up to date or eligible for a new vaccine, or potentially even missed a vaccine, so that you understand what that means and what health precautions you may take as a result of that. So and the medical provider side of that is an analytics framework that helps doctors and nurses to track their patient population and understand who's at risk and offer the right vaccines very quickly and hopefully proactively in their clinic sessions.
Wow. How did you get started?
I guess I came at it from a patient point of view, and from a patient point of view using this nice little collection here, but this was as I became a mum 10, 15 years ago. I guess that's when the vaccine space becomes probably more familiar to many parents. And I found myself having a few experiences where I had missed a vaccine, and not deliberately, but unwittingly missed a vaccine for one of my children. And a number of other experiences similar to that. So travelling to a jurisdiction where I was told a vaccine wasn't recommended, and then finding out that diseases were more prevalent than realised, through to a family member who was very unwell, finding out from another doctor that a good vaccine would be recommended for that person, and it hadn't been recommended by their own doctor. And ultimately they took it, but it shouldn't really be happening in that way. So essentially sort of felt that it was a very good opportunity to digitise something, because actually the whole space is very rules-based, which obviously lends itself very well to digital solutions. And I had a background in Accenture, so I'd worked there for a long time before moving abroad. I should add that I've moved around the world a bit in the middle of all of this. So started off, had my children when they were younger in the UK, and then moved to Asia, a couple of cities in the UK, ultimately ending in Hong Kong, and then moved back to the UK last year, or should I say 2 years ago now. So probably have the added complexity of moving around, but I would say the benefit of that is also understanding the challenge as it sits in many different jurisdictions, and an audience of people who do travel, which is a reasonably large portion of the world. And we've obviously seen the impact of travel on viruses and infectious disease through COVID, and it's a very relevant topic. So I experienced a number of these pain points, and I thought ripe for digitisation, and then really went into a research phase, validating whether my experiences were common to more people than just myself. Obviously, you don't want to create a solution that's just for you, and found out very much that it was. And I think really many of the takeaways there were, even for patients who are quite organised and on top of their health and their family's health, many of them had actually missed more vaccines than they thought, and certainly couldn't recall easily whether they were up to date or not. And often piecing that information together would either involve looking at documents like this and really trying to work it through, or potentially having to call a health provider, which obviously takes time and is something that not every patient will do. And that call is also obviously the time of a health provider for information, which in this age is not really something we want to be spending health provider time on. So I then subsequently took it to a doctor in Hong Kong and said, here's an idea, can we talk about the health provider side of that problem, which opened up an entirely different and sizable set of conversations that very much validated that there was a need on the health provider side as well. And that person is Dr. Lucy Lord, who ended up becoming my business partner. So it sort of went from can we see if this product might be something of interest to doctors, to a co-founding arrangement. And that really is where it all started. So we started off brought a team of digital banking experts in, because we wanted to make sure that data and security was obviously absolutely paramount. But also there's a lot of work that's been done in banking that is quite applicable into this space as well. So we made sure that we had a good blend of technology, security, patient perspective, and healthcare provider perspective as well. And we started off a build and test through a program, and a few years later, here we are with a system that has recently, we've just measured a 22% uplift in adult vaccination as a result of users being on the platform. So things like pneumococcal and shingles vaccine that addressing an adult population, and there's quite a pipeline of vaccines coming in for adults, and a quite sizable drop in admin for clinic staff. So we're sort of seeing a double whammy, I guess, people doing the right thing at the right time from a vaccine point of view, and a reduction in healthcare staff workload, but also quite often dull staff workload that lots of doctors and nurses complain about. And I think also probably an interesting part of it is the quite skill-specific domain information. So this is often the preserve of certainly nursing staff, but it's not always easy to find doctors and nurses that are very, very expert in this area. But obviously primary care will need to have that service in. So there's a lot of value that I think we've driven through data standardization and systemizing the solution to reduce some of the errors and risk also associated with the whole health space. Yeah.
That's absolutely incredible. What's the reception been like so far?
It's been very, very good, very promising. So we've had I think I would say that we have designed quite carefully with the patient in mind. And the idea behind this, it's an interoperable record. So what we mean by that is records can come in from different sources. So the idea being that, in today's world, a patient will take between 50 and 100 vaccines in a lifetime, depending on whether they have a health condition, they have a certain job that might predispose them to health risk, they travel, and or they choose to embark in some of the more privately available vaccines. And I think there's data out there that says patients will now interact with an average of 17 health providers across their lifetime. So obviously, and vaccines are interesting because it's a life course, right? You take vaccines at certain times to protect you when you're most at risk. And obviously also as new vaccines come in, as we've seen with COVID. So what you took when you were 10 is still relevant to what you might need to take later on in your life. And therefore that it is a health record that's really important to track all the way through your life, just as a patient to know what your risk profile is and what you need to do next, before we even get into all of the data research value of that information. And so, lots of patients are very keen on this because it is a proverbial pain to manage data in through books like these. And for all the digitization in the world, books like these are still being given out in very often very expensive healthcare settings, actually. So it's not about affordability necessarily, but that whole process of digitization and journey to it is a complex one, and it's obviously at varying stages of evolution. But we will find when you go talk to many patients that they are still working with this alongside potentially digital apps as well. So either way, their data is strewn across many different locations, and in order to join that live course record up, you need a way to do that and get the data into one digital home so that you can go and work out where you are on that journey.
Yeah, and I mean obviously across the NHS, we are abundantly aware that there's a lot of fragmentation in that space.
Yeah.
How much responsibility do you think falls on those service providers, the people that are actually, addressing some of these challenges, to actually try to bring this together a little bit more?
Yeah, I mean, interoperability is obviously a conversation point that has been going on for a number of years, and and it remains a talking point. And there's a lot to it, right? There's the technical side of it. There's the data governance. There's what patients think about it. There's privacy regulation laws, data security, etc. So it's not, it's not a straightforward one-party conversation. But I think from a patient point of view, there is tremendous value in being able to join the record up. Now, I agree that I know there are voices out there where not every single part of health needs tracking all the way through life. It would be very valuable, but it doesn't necessarily change the course of action. But there are an awful lot of areas where it does matter. And I think certainly for research and evolution, tracking the drugs that you take during life and the experiences that you have, all of that data is immensely valuable, right? And it's going to take us to a place where we can really discover what's going on with health and personalise it even more. So absolutely, we've got to be joining the information up, which means that service providers need to be doing the same thing. Yeah. I think one of the challenges today is that, certainly if you're thinking about either delivering a service or you're building a solution, you're usually doing it for a provider. And the provider is therefore an entity within that has a group of patients. It's provider-centric, it isn't patient-centric necessarily. So I think that's one of the things we've really tried to do is think, what does the patient journey look like across life? It's not just one provider at all, right? And that's the last thing that it is, actually. So we tried to design it for that.
Is there any pressure downward from a governmental level that you would see as having some sort of impact in standardising some of this?
Yes, I think that there's great value in governments putting more pressure on system providers to make sure that their systems are capable of being interoperable, and that the financial models around that also support interest in combining those things. I think the other piece is data, because you can be interoperable, but the data needs to be able to flow through the system in a way that really makes it transferable. And we do have standards. We have standards coming. But I think we're working with standards and they're not detailed enough to actually serve the purpose that we're working with. So we're having to define those, work on them. We recognise that government systems around the world are using different standards, and therefore passing that healthcare information, particularly if you're cross-border, is a completely different kettle of fish to doing it within a jurisdiction. But we've got quite a long way to go on data as well.
What could be some of the potential impacts that you think could be felt if we could coordinate our efforts a little bit more?
Well, I think they could be enormous. I mean, I think if you look at, our solution is partly about joining the records up and partly about making sense of the data across the patient life. Now, the really interesting part is making sense of the data, because that's where you can say to a patient, yes, you're up to date, no, you're not, etc. But it's of zero value if you've only got 2 records in there. And that's what we find when we go and talk to health providers, is that very often they can't really do their job very well because they don't have all of the data. So, and that's quite a broad scale problem. Obviously, national systems, when it comes to vaccines, have got more chance of having, a good portion of the data. But obviously, lots of vaccines start life in the private sector, and just because you took a vaccine in the public sector doesn't mean it's not relevant to the private sector doctor to know whether you took that or not. So I think that there's immense value for all of these solutions to be able to just layer the analytics on the top and not have to be worrying about piecing all the records together. Where what I think we're seeing is many companies who want to achieve a particular health outcome or help a patient to achieve a health outcome, but they're having to spend a lot of time and effort on joining the dots up. And really, we don't want to be doing that, right? And everyone could deliver much more cost-effective solutions if they didn't have to do that. So I personally see interoperability and data standards as being absolutely foundational, whether you're talking about AI or you're talking about any other kind of system, that we should be getting right as a nation. Absolutely.
Yeah. And I think you've hit on something that's really important as a point to probably drive home to people, which is obviously the integrity of the solution that AI or machine learning can provide is entirely contingent on the quality of the data that is input into it. So obviously we've touched on a little bit AI. What are some of the things that you would really like people to understand properly about AI, machine learning, and the fact that many people seem to think it's a bit of a panacea or a silver bullet at the moment?
Yeah, so we've been using machine learning and in an element of AI in our solution. But I think what's really, really important is data in, data out. And while AI systems are becoming, better at data quality corrections, if you like, we obviously recognise that there are an awful lot of issues around the accuracy of the historic data, and also any biases that might be in that historic data as well. So I think probably most people listening to this podcast will be reasonably aware of some of those challenges. I think where we found it very interesting is around the accuracy component, and also thinking about what's missing in the data as well. So from an accuracy point of view, I mean, we found it very interesting when we first piloted our solution, in that we found a 23% error stroke ambiguity rate in our data. And what that means is vaccine recording, where we couldn't be certain what the which vaccine was actually given to a patient. So, and that's something that a healthcare provider also couldn't be certain about, either without looking at the records in more detail, or possibly may not be able to tell at all from the history. So if we've got that kind of error rate, or ambiguity is as bad as error, really, right? Because you can't really work out what's going on. If you've got that level of information quality issue, then that's only going to pervade into the AI systems. So I think there's whatever we do, the data piece is absolutely foundational, whether it's about interoperability, layering on top of, or feeding into AI capability. It's critical to get that right. And I think probably the investor side is really where I've been quite interested as well, to look at the AI piece, which is, we had it a few years ago with blockchain. Blockchain's now kind of gone away, and AI is the new question. But with all trends and hype come followership. And I think it's great that investors ask the questions, but I think it's really dangerous when investors only look for the latest trend, because often people are putting labels on solutions to make them appealing, when actually that's not necessarily what's going on, often for really good reason, right? It's not necessarily the right solution for the problem to be solved. So I think we just need to be aware, ask the right questions from an investor point of view. You need to be cautious of not only going after those trends. We've seen blockchain, come back on itself to a degree when it comes to healthcare. So it's just about asking the right questions. What's the problem to be solved? What's the right technology to solve the problem?
I think what we are at the risk of doing at the moment is probably going into the weeds a little bit in terms of like the detail. If we took it up a little altitude higher, why is this work so important in terms of preventable, diseases with regards to vaccination?
So I think when I first came to this, it was very much, if I think about the strategic priority and then the nuts and bolts of things, the reason this was obvious to me as a problem from a patient point of view was in the nuts and bolts. But then when we started to go and look at the bigger space of the problem, then I think there are a few different factors. So number one, vaccines have been around for a long time, but we have gone backwards as a world since before the pandemic, really. I think the WHO identified vaccine hesitancy as a global health risk in 2019. And we're seeing, today in London, the issues of measles under vaccination. It's taken a very long time for HPV to make progress, and even something that can eradicate cervical cancer. Only 12% of the global eligible population is actually vaccinated today, despite that being around for a long time. So we've got a vaccine information issue, and we've got to try and write that as best we can. Otherwise, we're going to, underuse one of the great tools that we've got in our healthcare toolkit. I think it's fascinating that despite all of these vaccines, we spend, absolutely billions trying to find cures for lots of diseases, but we're leaving an awful lot on the table that we've already got. The US measures, I think it's something like 37 billion spent a year on diseases for which there is a vaccine. Undoubtedly, that will be undermeasured. We're not great actually at measuring the value of vaccines, because they have obviously their direct medical impact, but then they also have a huge societal impact. Now, that could be anything from, I don't think this has really been measured particularly well. We've been looking for data on it recently, but what's the impact on parents of vaccines allowing them to go to work? And that will have a female angle as well, because it's predominantly women who stay at home and look after children. So if their children are getting sick, they're not going to work. Obviously, that has huge knock-on effects. And that's just one very tiny slither in a great collection of journeys. So I think, we've got to recognise the problem. And it's not just a developing world problem. Developing world is a massive issue in terms of the equality of distribution. But this is still a problem in developed worlds where supply is not an issue. It's an information problem, and making sure that the services are there to allow this to be given. And it's prioritised as well. So I think, we look, whenever you read any strategy from any leading healthcare nation, prevention is core. We've got to move to more prevention. There are a great many vaccines in the pipeline. We need to be able to take those and have people really understand the benefit of them, and then choose in an informed way whether to take them or not. I think for me, one of the things I found very interesting coming from a patient perspective was that as a patient, you can't help but read the news and see the social media. And it's very, very easy, even if you are reading all the data as well, to feel a degree of nervousness, particularly if you're vaccinating your children, because there is so much chat around vaccines and vaccine hesitancy. And they're very powerful drugs, right? We should never not be cautious with them and think carefully about what we're giving to people. But as I've researched this area more as a patient, the thing that's really stood out to me is that I think vaccines get quite a hard rap. If you look even at adverse events from drugs, vaccines are quite a long way down the list. But it's very rare for people to talk about that. You don't often have to sign a consent form to take an antibiotic, but you do have to sign a consent form a lot of the time to take a vaccine. So I think a lot of the way that we operate around this, the normalisation of these risks, means that we take a different perspective and we have different perceptions of these things that can affect the degree to which we're happy to take them. So I am really keen that we get a balanced view and a fact-based view of the value and the risk of all of these products. I found something very, very interesting a few weeks ago, which was a study was done in the Netherlands quite a few years ago now on measles. And if you don't, for unvaccinated children who caught measles, not only did they suffer from measles, but they also had all of the antibodies associated with their early childhood vaccines practically eradicated. So not only did measles give them measles and potential complications of measles, but it got rid of all their protection from polio, tetanus, and diphtheria.
So it almost sets them back to zero.
Yeah, exactly, which is probably why when studies have been done in Africa, measles is so powerful, because it's also helping to, by getting rid of reducing the measles infection rate, you're also protecting the antibodies from those other vaccines that have been given. So, but you very rarely read that. I mean, you've got to look quite hard to find those studies. So I think if people understood more of this, and we could be, more balanced in our research and our information, that maybe it would allow people to think differently. And that's not swaying them, it's just giving them facts that are out there and discovering more about the benefits of those vaccines. And I think that's quite an important side of things. Another thing that I think is really, really important is antimicrobial resistance. So the impacts of antibiotics no longer working for us, which is a major risk, which might be the biggest health risk we face, bigger than cancer and diabetes in the coming years. Taking vaccines is one of the things that you can do. Now, I know most vaccines are protecting you from a virus, but many doctors around the world still prescribe antibiotics for viral infections. They shouldn't do. So if you've taken the vaccine and you therefore don't get the virus, you consequently won't hopefully be prescribed for antibiotics for those illnesses. And then the secondary infections that you may get from not being vaccinated, there was a study done not long ago on influenza that showed that by giving a flu vaccine to a population, you could reduce antibiotic use by 65%.
Wow.
So it's huge, but again, it's not something that even many nursing staff actually talk about and recognise. So I think, again, if we look at vaccines in the context of all the challenges we've got globally, the other factor is obviously climate change. And we're now seeing vaccines that we might have thought of historically in the UK as travel vaccines. So Japanese encephalitis, dengue, some of those vaccines we might have thought of those as being something we take if we go to the tropics, when we go to dangerous places, right? And that's kind of what I would say. I've heard those conversations take place if you go to Asia or you go to places where you might find yourself exposed to those infections. But those vectors are now making their way to Spain and the Med. So, they're changing. The risk profile is changing around the world. And undoubtedly, we will be thinking over time about taking vaccines to go to places much closer to home. And that is going to really change around the world, and it's already changing very quickly. So I think when you look at these big global macro challenges of antimicrobial resistance, climate change, misinformation, vaccines are really underpinning that, and I think they will become a big tool in that process. So it's really important that we can make the most of them.
Yeah, I mean, it presents an interesting challenge in terms of how do you get the information in the right way, because you have to reach people where they are and have it delivered in a way that they can understand and make a conscious decision to take a proactive choice.
Yeah, absolutely.
And I think one of the challenges that the loudest voices in this space often are not helpful.
No.
Often have been a spreader of misinformation and have caused a lot of confusion and reticence around that.
Yeah.
I don't know necessarily if that's a challenge that you're looking to solve, but I know that it's a challenge that does need solving.
Yeah, I mean, I think what we're looking to do here is we think that if you think about the very definition of preventative health, you shouldn't be engaging in a clinic to take it necessarily, certainly not to know when to take it. So because you're not unwell. So if you're not in a clinic, you shouldn't really be reading about taking a vaccine when you're in a clinic. You should be finding out about it when you're not in the clinic, because that's the whole idea of prevention, which is why digital is so powerful for this, because it needs to reach you when you're not in a clinic setting. Now, I recognise fully that digital won't be something that every single person will use, but I think we're now seeing that many older age people are absolutely engaging in it and looking to use it as a core way of getting information. So I think what we can do is look at and many organisations are looking at this, vaccine confidence projects, etc. Where are the trust marks? So doctors, health professionals are still seen as very powerful in that engaging conversation with a patient. What we're trying to do here is we observe through our research that if you don't have your records straight, number one, the doctor is not going to easily be able to have that conversation anyway, because they're not going to know that it's a conversation to have. So we need to arm healthcare professionals with that right information, and particularly in an environment where the time available in clinic sessions is reducing, right? So, and if doctors and nurses are going to make that a conversation as an add-on to something else, which they quite possibly are, it can't take you 5-10 minutes to work out in the system whether a patient's due for a vaccine or not. So it needs to be immediately evident, and they need to understand how best to talk to that patient. And I think we're very much getting to a space where I think the Imunis solution allows them to know straight away, are they up to date, are they not up to date? There are many other components of health, and I think lots of research now where we can plug then information into that and make it much easier for the health professional to have the right conversation with that patient. Some patients might be driven very much by data and facts. Others might have, there might be a lot of work to undo around information that they've heard. Other people might, we know, are more influenced by what their family members or their friends think. So I think it's a multifaceted approach. One of the things we have done at Imunis is built a schools engine as well, recognising that obviously many vaccines are given in a school setting, but also schools struggle quite often. They may well take vaccine records in at admissions, so they're sort of indicating that they want to know that children are vaccinated on their way in, but often they don't have a lot to do with that afterwards. And if they are part of delivering vaccine programmes in a school setting, they often don't have the staff to communicate with parents about the questions the parents might have about the effectiveness of the vaccine, what's being given, etc. So the purpose of that platform is to help schools be able to do that efficiently and effectively and in a consistent voice. And I think it's those kinds of touch points that are going to be really, really important to allow the right information to get to the patient at the right time.
Massively so. I know we touched on, data there briefly. I think one of the key challenges obviously is data governance.
Yep.
And the question that I have also following off the back of how we potentially engage in that.
Yeah.
is what is the benefit with access to this greater data set of higher quality that we could use to move the needle on things like antimicrobial resistance.
Yeah, I mean, I think at the moment, if you think about all of those data points, I personally think there are some very interesting areas in relation to this domain of health that are everything to do with why some people react the way they do to vaccines. And very often when you have those events, patients don't even know what vaccines they've had before and what other drugs they've had. So I think in the future we can be very hopeful that their health record will be much more comprehensive, and there are other data points about them, whether it be genetic data or it be lifestyle data that are going on, or allergies, that kind of thing, will all come together so that we've got more power to understand what's actually going on. Even the digital twin technology could be fascinating, right? I think the idea that you could model how patients will react to certain things based on history is fascinating.
It's so fascinating. It's such a fascinating one because it's also a bit of a Pandora's box if it's used incorrectly.
In the wrong way, yeah. But there are some amazing potential use cases for it, absolutely. So I think that is one space. I think then connecting together the testing as well is a really important part of this, because I think we've seen with COVID obviously that understanding a person's infection history alongside a vaccine history and everything else together is actually really important. I mean, when I was growing up, you went to the doctor and you got a virus. You'll go home, you've just got a virus. Well, it's good to put names on those viruses and understand what they are, and then study them and understand how they interact, because undoubtedly they are having an effect on our health. One of the vaccines I'm following very closely is actually for Epstein-Barr virus, which is the glandular fever virus. But, very interestingly, is connected not only to a few cancers, but also to MS. And so we're seeing, really interesting things in that area where if we know there's an interaction between the Epstein-Barr virus and certain genetic or lifestyle factors that predispose people to developing MS in the future. So, if we can start to get into some of that space, I think there's just immense potential there for us to really go after the big diseases.
Yeah, what do you think a future looks like where we were able to combine all of these data sources and really tackle this problem?
Well, I think there's a reasonably long way to go, as in we've obviously got to tackle this data governance challenge. I think if you can use anonymized data and patients can be looking to donate that lifestyle data, I think people are generally very, very well-intentioned and very keen to do that, is when it's the privacy angle and the wrong things can happen with that data. But I think it's vastly exciting. I mean, you look at the vaccine pipeline now, and there's a huge volume of new products coming in, and just the speeding up of research that can be done. I'm sure we're just going to see more and more fast tracking of that, alongside the testing as well. And I think the testing is a really, really important space. So the ability to understand the viral and bacterial journeys that people go on with better data. And think about it as a prevent, screen, treat journey, so that we can be more knowledgeable and really spotting, much as we do with HPV now, spotting the risks before they really become a risk. There's immense potential there. So it's exciting.
It definitely occurs to me that there's so much opportunity for some of these diseases to potentially be eradicated.
Yep.
And with a more complete and comprehensive record, you would be able to have that much broader data set. You'd be able to kind of inform particular populations, and also that would then tackle some of the hesitancy issues that we've been speaking about, where particularly certain populations have notoriously been hesitant.
Yes.
And that's something that I think is also another lever that we could pull
Mm-hmm.
to this conversation as well.
Yeah, I think so. And I guess the important thing with all eradication is that many people have got to take the vaccines, the current vaccines that we have, even when the virus or the bacteria is not very present. I'm quite hopeful that we'll get to a point where the vaccines, with all this data that we've got and all of the development in the vaccine platforms, means that we will get much more effective vaccines as well, which will hopefully enable all of that to be much more effective and speedy.
If you could leave our audience with one thought, what would that be?
When we talk about Imunis with some of our customers or investors, we often say, as our leading question, do you know your vaccine status? So, and most of the time, people are at best not 100% sure and quite often completely unclear. So that would be one of my questions is, do you know where you are on your vaccine journey? One of the big misconceptions is that vaccines are only for children, and they're absolutely not. So there are vaccines that we should be taking as adults, and if we didn't take some of our vaccines as kids, we should still be taking them as adults and making sure we're up to date. So I would encourage people to go and, depending on your situation, either root in your lock-up drawer and see if you can find that piece of paper that your mum maybe gave you years ago, which is definitely a case that we see, or look on the NHS app, look on your health app, and see whether you can work out not only what vaccines you've had, but where are you on the schedule that you should have been following.
Yeah, and I think we've spoken off camera previously about an example with the shingles vaccination, where actually you may have had one at a younger age, but there are situations in which it's entirely appropriate for you to have that booster, have that top-up. So becoming more aware of those vaccinations that you maybe should be getting.
Very much so. So the ones that come to you as an adult, I think understanding even the flu vaccine better. There's a big push at the moment for, in some places, for the flu vaccine to be considered a travel vaccine. I think that's really interesting because when you look at the data, you look at health insurance, travel insurance claims, people getting really sick from the flu while they're away, that's quite a big problem. We don't think of it like that very often. So yes, I think just understanding what you've had historically, do you know your risk, taking a bit more interest in that and thinking about what you can do to protect yourself so that you're not a drain on the health system. That's, what we should all be trying to do.
Yeah, it comes back to something that I spoke to Tim Murdoch about, which is that social contract that we all have, where we take care of ourselves as best as we possibly can so that ultimately we can take care of that.
Exactly, and vaccines is the one where you can, and we do a little bit of this with our app actually, it's making you feel good about not only your own health but what you're doing for other people. So whether that is taking your flu shot and protecting your grandma and the people you might meet on the bus who might have a health condition that really puts them at risk, the pregnant women that you might see when you go to pick up children at school, that kind of thing. It's thinking about the vaccine in that context as well. So it's one where it really pays for other people. And for the health system, we moan like mad every year when we can't get a GP appointment in December, but it's quite often the same people who haven't taken their flu shot who maybe are spreading it around. So we're all capable of it. We should all look and think, what can we do to try and help the system?
Yeah. If we were to be really proactive about time horizons, short, medium, long term, what would you like to see across the three?
Across all of health, or maybe in this space,
in
this space.
We'll keep it focused in this.
Keep it focused in this space. Short term, system-wise, I would love to see a situation where patients are just aware of where they are on that journey, and that we don't have situations like we've got now with measles, where whole nursing teams are on the phone in certain parts of the UK having to call people to remind them or ask them to take a vaccine, because we don't have any extra resource here. Those people are just being, redirected from something important to this. If we'd taken the vaccine at the right time, those people could be doing what they were doing, which might be running an HPV vaccine program or something. I think what we've got to look at is whenever there's an outbreak or a catch-up, very often we are just rediverting resource from something else, and therefore we are applying cost into the system. So short term, I would love to see a situation where people know where they are and are actively really trying to get the right information and take the right steps, and ask the right questions in the right places. In the medium term, I would love to see success of things like the RSV vaccine. That's rolling out around the world at the moment, mainly targeted right now at actually the older population, which is brilliant because it affects, when we look at our NHS crisis again in December, it's often a tripartite of COVID, flu and RSV. So if we've got vaccines for all of those and we're all optimising, then we could really help that crash on the NHS in the winter period. And then if we can start to roll those out for children as well, which is there are efforts to do, I've got many friends who were very stressed with their little children and babies in hospital with bronchiolitis and all of those kind of conditions that, can really be helped by vaccines like that. So in medium term, I would love to see that. And long term, I guess it's probably more of a global one like malaria, right? I mean, that's one of the biggest killers around the world, and massive progress has been made. And if that can be rolled out, then again, the massive economic benefit that might bring will be enormous. And I suspect it's one like a measles where you start to do that, you start to see massive knock-on effects. So I would love to see that as our long term.
Incredible. Emma, this has been absolutely amazing and fascinating to find out more about what it is that you're doing and the potential impacts that this could have. If people want to find out more, where can they go? How can they find you? How can they get in touch?
Well, the Imunis website has contact information, and you can get me on LinkedIn, and those will be the two main ones, I would say.
Is there anything else you'd like to add?
I would add that we're always interested. This is one area of health, and it's very important for everybody, but it is only one space, and therefore we as an organisation are very focused on partnerships, whether that be working with companies looking at antimicrobial resistance because we can help one another, whether that be talking to companies that are dealing with specific health conditions where patients really benefit from taking vaccines, and that's a big push, or anyone else in the industry who can see an opportunity to plug in what we have built. So we're very, very interested in partnerships. We're also looking at investment and any schemes where we can spread what we're doing. So reach out to me. Best mechanism will be either through the Imunis website, and it's IMUNIS, not double M, and or through LinkedIn.
Incredible. Well, I highly encourage people to check it out and get in touch.
Thank you very much. Great to speak with you.
Likewise.
And thanks for all the brilliant work on spreading the gospel on so many different parts of healthcare.